My name is Oldri Sherli. I'm from Indonesian Positive Women Network. I also focal point for Youth League Young Kid Affected Populations Network based in Bangkok. So, presentations. So, addressing the sexual and reproductive health and rights of women living with HIV and young women living with HIV. So, I will share basically the ASEAN Pacific situation specifically for Indonesia. The background, you can see that UN is regional supporting Asia Pacific on the document Getting to Zero 2011 reported 35% on AIDS cases in Asia Pacific are women, and most of them are infected by their intimate partner. So the majority of women living with HIV also in Asia Pacific, in Indonesia, there is like women using drugs, women sex worker, and also women who have a partner using drugs, and the other thing is housewife woman is getting high. So, and the second thing is poverty, gender inequalities, decline, discriminations, and also cultural norms share many root cases on HIV infection. In 2011, political declarations on HIV and AIDS outcomes said women and girls should be able to exercise their sexual rights, including reproductive health and rights, free discriminations, and also violence. So, this is the woman living with HIV situation in Asia and Pacific. The situation is on women living with HIV regarding SRHR is really lack of information, and it resulted unwanted pregnancy and also not consequently using condoms. So there is also lack of awareness and economic dependency factor of women living with HIV to access sexual reproductive health and sexual reproductive health services. Women living with HIV in Asia Pacific also get discrimination in health services. In Indonesia, we have many women living with HIV and also young women living with HIV get forced sterilizations by healthcare provider, and also women sex workers in Indonesia have reported discriminations by healthcare workers when they access SDR services. So there is a quote for Vietnam. When I was delivering, the doctor left me alone and the baby coming just falling down. This is we found in a positive and pregnant study who are coordinated with VAPN Plus. And also the main challenges is the sexual reproductive health and rights services do not integrate with HIV and AIDS services. So there is no specific program and budget allocated to integrate these services. The thing is because the government and then the international development partner do not have commitment to allocate budget and also specific program to integrate these services. It happens in Indonesia. There is no referral services on HIV to SRHR services. For example, when a woman living with HIV go to the GSP or care support and treatment services and ask for the pap smear services, and the counselor do not build the referral system to the sexual reproductive health services. So women living with HIV get many infected of STI in Indonesia. And then the third thing is Indonesia have a unique or horrible law regarding population law, because the law said in the one chapter only women who are married can access the SRHR services. So when you are a young woman, you cannot access like pap smear services, and also you cannot get information regarding sexual reproductive health and rights. It's really related to the morality, and also sex is taboo in Indonesia because we are one of the big Muslim country in the world. So the thing is, it's really not supported for young women. And then the fourth thing is gender inequality and cultural norms are not supported for women rights issues. So patriarchal issues in Indonesia. So women very risk to get violence. And my organization tried to answer these challenges. We conducted a protest in Indonesia National AIDS Summit to raise sexual reproductive health and rights and violence against women's issues. one of the big issues in this protest is forced sterilizations, because we already collect 9 provinces in Indonesia where get forced sterilization. And now there's so many research are conducted in ASEAN Pacific who are capturing specifically forced sterilizations in Indonesia. And then the second thing, we conducted a study related to SRHR, which is there is a feminicide violence against women in the Asia Pacific. The first study is maternal health study in 6 countries, which conducted by APN Plus, and then the second is prevention parents of child study in South Asia, which is conducted by ICW Asia Pacific, and then violence against women living with HIV survey, and gender analysis study on prevention parents of child transmission, and then the last we are developing sexual reproductive health and right module for women, specifically for women living with HIV and young women living with HIV in Indonesia. And then we also conduct CEDAW training in Cambodia, Indonesia, and Malaysia. In Indonesia, we already submit CEDAW position paper last year because there's a thing for forced sterilizations issues and also the population law regarding the female for young who do not access the SR services. So the main of this training is to increase the capacity of women living with HIV to know about the CEDAW frameworks. And then we also conduct sexual reproductive health and right training on our members in Indonesia, which is involved young women living with HIV and also women living with HIV, who will be a trainer in the 10th province in Indonesia. And then our achievement now is, first achievement is our National AIDS Commissions. National AIDS Commissions now is preparing for women in HIV and AIDS action plan that will be create gender perspective on AIDS prevention program. And then the second, we are succeeding collaboration with CEDAW Working Group Initiative to integrate violence against women living with HIV and the women who were research into the CEDAW Shadow Report. The good news is Indonesian new minister now is committed to solve sterilizations issues among women living with HIV together with Women HIV Group and other GSO. Because the new Indonesian Health Minister is National AIDS Secretary in Indonesia. So she is really sensitive about the women and women living with HIV issues. So thank you very much.